I'm Benoit Peyronnet. I'm a French urologist working in University of Rennes, and my practice and my area of expertise, I would say, are really focused on all pelvic perineology, functional urology, neurourology, and so the very topics that are at the heart of the ICS. I think the interest around robotic surgery in our field and at the ICS has been growing and growing, and so we also have the opportunity to do a plenary session on this same topic of robotic urogynecology, functional urology, pelvic perineology. We'll be covering other sort of surgical procedures, other surgical techniques, and yes, same very nice panel of experts from all over the world, urologists, gynecologists. Robotic surgery has been gaining momentum more and more, and now we can clearly see that it's really there at the ICS. And I think we do have now robotic surgeons involved in our field, and that's really exciting. I think it's still only growing, and we'll keep having more and more sessions on those topics every year. As a young trainee, you look up to the ICS for answers to your daily practice questions. And the annual meeting, of course, is really the heart of this, like really the moment in every year where internationally we can gather all together in one place for a couple of days, going over all the like really practical questions that we have all over the year, and of course all the research questions. So it's a fantastic event to learn, but also to meet people from all over the world who are dealing with the same kind of issues that you are dealing at your place, and very, very nice networking and socializing event. You really get the opportunity. So that's one of the beauty of the ICS. Is compared to other international meetings, it's big enough but not too big, so that you can really have interaction with a lot of people there. One of the things that I like the most is always a multidisciplinary aspect in the ICS. Exchanging views with someone from another specialty, they always have a different vision from ours, and you do learn sometimes much more than talking to your peers from your own specialty who we have most of the time common views on similar problems. So that's all those opportunities that I'm really looking forward to finding again at the ICS this year. Maastricht is really an historical place for pelvic perineology, functional urology, neurourology, the place of many innovations, many pioneering works, great expertise of the several teams involved in pelvic floor medicine, I would say, and so being where all of these things happen in the heart of Europe, I think I've never been to Maastricht, to be honest, but the city seemed very nice and exactly as ICS. Not too small, not too big, so that we can be all together and enjoying ourselves. And so, yeah, I think it's gonna be a great meeting again.